Welcome to the Reggie White Cardiopulmonary Rehabilitation Center with two convenient locations, one at 7420 Guthrie Drive North in South Haven, Mississippi, and our newly remodeled single-story 10,000 square foot center, complete with full handicap access, located at 2715 Kirby Parkway in Memphis, Tennessee. The center was founded in part by Sarah White, widow of the University of Tennessee and NFL legend Reggie White, in an effort to contribute to the health and well-being of the public and to help ensure that patients with heart and lung disease can receive education and supervised exercise. On December 26, 2004, at the age of 43, Reggie White suffered a fatal cardiac arrhythmia. The most likely cause of this, according to the medical examiner's office, was a cardiac and pulmonary sarcosis for which he had lived with for years. It was also stated that sleep apnea, which he was known to suffer from, may have also contributed to his death. The Reggie White Cardiopulmonary Rehabilitation Center is named for and in memory of Reggie White. It is a comprehensive outpatient facility offering personal services from counseling to physical therapy. Cardiovascular and pulmonary rehabilitation treats a wide variety of individuals with cardiopulmonary disorders or those who have had cardiac or pulmonary surgery. The primary goals of this specialty include increasing endurance and functional independence and to prevent further complications from heart disease, lung disease, and obesity. We hope this presentation will give you a better understanding of the services we can provide and the benefits we can offer to you on your road to recovery. And thank you from all of us at the Reggie White Cardiopulmonary Rehabilitation Center. Our intake specialist will be there to greet you when you first come to the Reggie White Cardiopulmonary Rehabilitation Center. Among other things, they will answer any questions you have on what to bring for your first appointment. For instance, you'll need to bring your insurance information because Medicare, Medicaid, and most insurances will cover the costs of most, if not all, services. You will also need to bring a list of your current medications and any other medical information you think might help you. They will set you up with an appointment to be interviewed by a respiratory therapy specialist and then put through a couple of tests for endurance. All of the appointments are made at your convenience, and you will be taken on a tour of the center during your first visit. So give us a call. You'll be glad you did. This is the first day of the rest of your life. On day one at the Reggie White Rehab Center, we'll sit down with the patient for an initial evaluation and consultation. During this evaluation, we'll take a brief patient history, a short physical, and a 6-minute walk, the purpose of which is to evaluate the patient's baseline endurance. We determine what their current level of fitness is and inquire if the patient currently smokes or has smoked in the past. We determine if there are current or ongoing joint or muscle issues that we need to know about so that they are not aggravated. The patient is then consulted about their meds, especially their breathing medications. We make sure that they are aware of all the side effects and that they are taking the medications properly. The 6-minute walk is performed by a respiratory therapist. From this test, we're able to determine whether or not the patient needs to wear oxygen and what the functional ability is in the 6 minutes. Some of the patients not able to achieve that through other reasons, such as muscular or skeletal issues, are referred to our physical therapist. From a respiratory standpoint, the goal of the 6-minute walk is to determine oxygenation stages and endurance. On day 2, you'll complete a short, low-impact, low-stress workout on the exercise machines. This is to check your physical limitations and will aid us in determining your personal program and your goals. So for a more active and happier lifestyle with a reduced risk of illness or hospitalization, let us coach you in achieving these goals. At Reggie White Cardiopulmonary Rehab Center, we are dedicated to improving patients' lives through education, exercise, and individual counseling in a safe, comfortable, and healing outpatient environment. Our cardiopulmonary rehab program is designed to assist patients with cardiac or pulmonary disorders and to resume productive lives and make a lifelong commitment to exercise and good health. The program consists of 4 components. Patients follow carefully planned individually supervised exercise, cardiac monitoring, along with medication and nutrition counseling. Candidates for outpatient cardiac rehabilitation include those who have had a heart attack, bypass graft surgery or other heart surgeries, balloon angioplasty, or diagnosed heart disease. Our cardiopulmonary rehabilitation program also offers services for people with risk factors including elevated cholesterol, high blood pressure, smoking, sedentary lifestyle, and overweight. And as always, a customized personal program will be developed. Pulmonary rehab isn't just for people with COPD. It is helpful for any pulmonary disorder that limits endurance or causes shortness of breath. It is designed to help manage the conditions through exercise and education. Participants regain confidence in their own abilities and feel improvement in their overall quality of life. Oxygen is provided for patients if needed. The Reggie White Physical Therapy and Weight Loss Departments work one-on-one with their patients. All efforts are made to return the patient to their past functional status prior to the injury or illness. Patients are given individual exercises determined for that individual's impairment and limits. Physical therapy works with gait and balance activities. Modalities such as a hydrocollator for moist heat, as well as cold packs and infrared treatment are used for pain and flexibility improvement, as well as to improve the symptoms of neuropathy. E-stim treatments are used as well. We meet the needs of the individual patient and improve the quality of mobility so as to return them to activities of everyday living. If you work with us, we'll work with you. Problems such as diabetes, hypertension, stroke, and heart disease most often have the common underlying problem of obesity. Doctors that advise patients to lose weight by exercise and diet control do not always realize that more help is needed. Reggie White Cardiopulmonary Rehab Center provides that help. Our nutritionist works closely with you and our exercise physiologist to provide an effective and simple plan. Your participation will create weight loss and teach good habits needed to provide easy maintenance once the desired weight has been achieved. Your success is our success. By watching this presentation, you have taken the first step to a new you. Have you been having a hard time breathing? What about muscle spasms or cramping? How about your blood pressure? Would you like to improve your flexibility and your range of motion, or just have a nice relaxing massage? While you're at your initial evaluation, tell the therapist that you would also like a massage therapy, yet another service that we offer that is covered by your insurance. Feel better through deep body massage. We offer confidential and comprehensive treatment of general psychiatric disorders with specialized expertise in the treatment of stress, anxiety, and mood disorder. Patients with persistent symptoms such as depression, this may be deemed appropriate at the evaluation counseling. We also offer the American Lung Association Smoking Cessation Program. This is yet another program which is covered by your insurance. Our team consists of board-certified physicians and respiratory therapists. We encourage you to ask any of our team members to assist you in any situation that may contribute to a healthier lifestyle. In addition to their own areas of expertise, they can also offer suggestions about other potential resources. Let us be your coaches for a better quality of life.